Back to talking about fibrinolytics or thrombolytics. If you look in your textbook on page 275, we start the section on fibrinolytic drugs. They were previously called thrombolytics. And if you look down at the bottom of page 275, you see table 14.2 that refers to the different fibrinolytics. Probably the one you'll see the most and that we'll talk about are Alteplase, which goes by the name TPA, tissue plasminogen activator, sometimes called Activase. They sort of take that clotting cascade that I showed at the beginning of this chapter, and they sort of almost work it backwards. They convert plasminogen to plasmin. Plasmin will break down those fibrin clots, break down fibrinogen and other plasma proteins to actually dissolve clots. Now, you can't just go around dissolving any old clot anytime. There are some guidelines. The uses for Alteplase are acute MIs. They use TPA, and it's best if it's given within 12 hours of the onset of MI symptoms. So it's very important that our patient is able to tell us when these symptoms began. They can use them to dissolve pulmonary emboli. TPA can be given at the onset of an acute ischemic stroke, and that's part of the reason why when you're told to look for the signs of stroke that you note when these symptoms start. Usually about 3 hours is the point at which the damage is permanent and the benefits of the TPA would no longer outweigh the risks. Very, heavy duty medicine. And so there's only a certain amount of time. After that, the lack of oxygenated blood to the brain is going to be severe enough that there will no longer be any benefit to the TPA. They can also give TPA in the event of an acute arterial occlusion. So a major artery is blocked to an organ or to muscle tissue. They can use TPA to break that up. I know I'm bouncing this slide a little bit. It's like you're watching the Blair Witch Project, but I am going to try to keep it steady. So make sure that you read the section on fibrinolytics, page 275. Unfortunately, you're going to have to be doing some reading and eventually some writing in this little section. But just remember that fibrolytic drugs are IV, and they're very high alert drugs. The last thing we're going to talk about in this chapter and in ATI are meds that are given to help the formation and repair of red blood cells. In the textbook, this is covered on pages 276 to 277. And in our ATI book, chapter 23 covers these particular drugs. You're going to want to know this for ATI testing, so make sure that you read the ATI book, and I probably will be assigning the ATI quizzes also sometime next week. So make sure you're on pages 193 to 198 of your ATI book. The drugs we're going to be talking about go under the name epoetin alpha, that's the generic name, and you will see them referred to by their trade names Procrit and Epigen. This is synthetic erythropoietin, and erythropoietin is something the body usually produces that increases red blood cells. People who have renal failure, who are getting chemo for cancer, who have HIV, especially if there's certain drugs that they're taking like AZT, their red blood cells are wiped out. And so these patients will be given injections or an IV infusion of these particular drugs to help them build up their RBCs. Depending on what's going on with your patient, these injections will be given sub-Q, or they may be brought in to an infusion center or in a clinical setting given IV. Dosing can be anywhere from 1 to 3 times per week, depending on the diagnosis of the patient and how badly it's needed. as nurses, we need to make sure that we are monitoring BP. We talked about how these anticoagulants are not blood thinners, but these particular drugs, the Procrit and the Epigen, and similar drugs, could be referred to as blood thickeners. If you look on page 277, at the top, we see erythropoiesis stimulating agents. They're going to cause more blood cells to be created, and therefore they are going to thicken the blood. So we have to watch blood pressure. We have to do CBCs with differentials, looking at the other different kinds of blood cells. We're going to look at platelets, your serum iron, how much iron, what's your iron level in the blood, and then your fluid and electrolyte balance, because these drugs can affect all those. The most common side effect, which can become an adverse effect quickly, is hypertension. So you want to constantly be watching the patient's blood pressure. They might have a headache, especially if the blood pressure is rising. They might experience some nausea. They might, because of the viscosity, there's that word again, increase in blood viscosity, it could lead to some cardiovascular events and the immune system turning around and attacking the red blood cells. So we always have to be on the lookout for that. But the main thing is to be checking the BP. The most common regular side effect is just pain at that injection site. You give that sub-Q injection and it's uncomfortable. But we're going to look for these other adverse effects: hypertension, headache, nausea, cardiovascular events, autoimmune-related anemia. So there's going to be orders for checking blood pressure following this. When you are getting ready to administer Procrit or the other drugs, you do not want to shake the solution and break those molecules. It's protein. You want to just gently rotate. There are no preservatives used in a bottle of erythropoietin, and so you want to use what you need and then discard the remainder. There's no way to keep it good. One of the biggest worries is seizures, so you want to watch for a rapid increase in hematocrit. And you're worried about hypertensive encephalopathy, where the blood pressure rises so quickly, so high, that it actually causes the brain to swell and have inflammatory reactions. So you're going to be watching blood pressure, seizure activity, and a possible change in central nervous system status. So this is the last slide for chapter 14. So make sure that you watch these videos, and while you're watching the videos, you can keep one tab open with my voice going on and on while you scroll through the posted PowerPoints. You also can run the PowerPoints off at home and make notes on them, or just make regular notes as you're listening. And you can listen to these thrilling lectures over and over again to get material that you might have missed. You're going to need to read your book. I know it's painful. I know people don't want to, but you've got to read. I will not be posting assignments until the end of the week, and they'll be due sometime next week. But I do have them sitting there waiting in my documents to be posted, so make sure that you're reading chapter 13. I'll have to let you all know about the test over our endocrine and diabetic chapters. I'm still not sure how that's going to shake out, if we're going to have you come in staggered groups to get a paper test, or if I'll have to put something online. So I will keep you posted. Please, please, please be checking Edmodo frequently. Check it by 8 every morning. Check it again by noon. Check it by 3:30 p.m. and be working on everything in between. Contact me by email if you have questions or if you need anything. Send me an email if there's anything you don't understand, and I will get these uploaded. All right, I'll see you in chapter 13.